How would you like to be able to heal chronic conditions with herbal medicine? Bonnie D'Arcangelo will tell us how. She is a clinical herbalist and holistic health consultant. So, Bonnie, tell us, how can entrepreneurs heal chronic conditions or reduce the pain of chronic conditions with herbal medicine? Heal Podcast with Lily Patrascu shares longevity and anti-aging techniques to stay young forever, increase energy, overcome addiction, and live your longest, best life ever. Shared by world's most innovative, alternative, and traditional health thought leaders, healers, and doctors. Discover quantum healing strategies to heal your mind, body, and soul.
That's a big question. And so I'm going to start first by demystifying a few things about herbal medicine. Herbal medicine is not walking into your local store and buying a bottle of supplements off the shelf that contains herbs and taking it home and expecting that it's going to heal your chronic conditions. Herbal medicine is far more complex than that. And just like you wouldn't take a pharmaceutical drug without a prescription from your doctor, you really need to consult with a highly trained herbalist. There's lots of people out there who call themselves kitchen herbalists and love to use herbs, and it's absolutely wonderful. But when it comes to chronic conditions, they're really complex. And the difference between herbal medicine and traditional or conventional medicine is that we don't look at disease states. We look at underlying dysfunction that has taken place in the body. So for instance, I could have two people who came into my office with diabetes, and I'm not going to treat them exactly the same. I'm going to treat them differently because each one of them ended up at that state through a different path. Somebody may have had an underlying kidney dysfunction that manifests in a certain way, or somebody could have an underlying liver dysfunction that manifest in a certain way. And this is what we need to understand about herbal medicine, is that it is not the same as allopathic medicine, which is what we call conventional medicine in the herbal world. We're not treating diseases, we're treating people. And people are very, very unique, and they've arrived at their condition in many different ways. In conventional medicine, they label it with a disease name. And it's really important to understand that we are not diseases. We are people, and we have these little idiosyncrasies to all of us that we have to look at. So when somebody comes into my office and they're experiencing a certain disease state, we first kind of unravel their history to before they ever entered into that state or condition, to find out what was going on prior to that. Perhaps they were having some liver issues, and so they were having some problems digesting their food because our liver creates the enzymes that are released into the stomach to allow us to digest our food. And poor digestion and malabsorption of food can eventually lead to several different chronic disease states. And so when we think of something like diabetes, we typically think about somebody who's eating too many carbs or sugars. And while that is certainly a dietary case that can lead to dysfunction of the body, because the body cells do not like to have a high carbohydrate and high sugar diet, and that's what causes the dysfunction of them. And here's another myth we'll bust is having a low-fat diet is actually not healthy for the body. And there is a lot of information, and it's finally starting to reach the public about why healthy fats are so important. If we think about the cells in our bodies, they're entirely composed of lipids, which are fats. They have a lipid bilayer that protects them, and they're built out of these fat cells. And then if we think about our brain, what is our brain? Our brains are fats. And so in order for our body, our cells, and our brain to function properly, we have to have healthy fats. And part of the problem is the fats that people are ingesting are not healthy fats, particularly when it comes to seed oils. There's a reason why your olive oil is cold pressed, because when that olive oil or other seed oils get heated, it changes their molecular structure. And then they're no longer healthy fats for the body. So part of being an herbalist is not just recommending herbs. It's also looking at people's diets and their lifestyles. And when I create an herbal formula for somebody, it's never a single herb like you would get in a capsule form at a store. They're usually very complex and they can have anywhere from 7 to 15 herbs in a formula. And most traditional Chinese formulas will have 20 to 34 herbs in a formula. And some Ayurvedic formulas even have up to 75 herbs. Now, those are very like extensive formulas that were worked out over thousands of years. But when we're creating an herbal formula for somebody, especially when they have a chronic disease state, we're looking at the function of all of the different organs in the body and all of the different issues that the person is experiencing and manifesting through that disease state. And we're supporting those because, again, as an herbalist, we're not a doctor. We don't treat diseases. We treat a person and help to support their optimal function of their body. So that's kind of the long answer to how do you treat chronic diseases is you have to really kind of look at this whole big picture and come at it from like a full approach of having a very tailored fit program for each individual. So there's no one size fit all for herbs. I talk to a lot of women, especially women who are going through menopause, and they'll say, oh, well, I tried black cohosh and it didn't work for me. And I said, well, that's because black cohosh by itself doesn't really work for anybody. And so understanding that, I think, is one of my biggest roles as an herbalist is helping people to understand how to use herbs properly.
Thank you. So what's a good process to follow to first get the right diagnosis?
So again, an herbalist isn't going to diagnose you with a disease state. We're going to look at the energetics. So I'm very trained in traditional Chinese medicine, which I think offers a really good framework for most herbalists to work through. And so we look at 4 types of manifestation to kind of simplify it here. We have hot and cold, and then we have damp and dry conditions. And you can have any combination of the two. So you could have a hot, damp condition or a cold, damp condition. And it goes on in those combinations. And so that's the first energetics that we look at because each herb has energetics themselves. So a particular herb could be very drying or it could be very moistening to the body. And so we have to understand the person's energetics of their body first, and then we have to match them to herbs that help to balance out those energetics. So this is where some people have taken herbs and they've actually made them worse because they could have a very hot, dry condition, and then they took an herb that was very hot and dry, and it exacerbated their issue. And so to truly work with herbal medicine to heal chronic disease, you have to work with a highly trained herbalist so that they can properly assess your energetics and match you to the proper herbs for your body.
Thank you. So give us an example of the hot and dry and damp and cold kind of, give me like one example so that we can kind of understand a bit better how this would work.
So I'll go back to the menopause example with the black cohosh because this is a very popular herb that a lot of women here will really help them with their menopausal symptoms. And so not all, but a large majority of women going through menopause are struggling with what we call a yin deficiency. So this is like a cold, wet deficiency. And so they need some supportive elements for the fluids of their body to help to increase their efficiency. And so a black cohosh is going to be a very hot, dry herb. And so it's going to agitate that yin deficiency and make it worse. And so we would come in if we see that, like, for instance, black cohosh is very, very effective. But we need to support the energetics of that herb so that it doesn't damage the person's condition. So there's a very famous Chinese formula called the Women's 6 Herbs. And this contains processed Rehmannia in it, along with 5 other herbs. And the importance about those 6 herbs is that they all work to balance those energetics, and they look at that, like, that yin deficiency that most women are struggling with during menopause. And so a yin deficiency is going to cause a lot of symptoms of dryness and irritation and inflammation because there isn't the fluids to moisten those surfaces. And so that women's 6 herb is going to come in and have those balanced energetics and will provide some some of those hot, dry herbs that you need to help with the particular condition, but it's going to balance it with herbs that are cooling and moistening to help support that yin in the body. So, in making an herbal formula, we kind of have like a 4-pillar system. You have like a chief herb, which is your main herb that is for their pattern and condition. And that could be something like black cohosh. But then we recognize that that black cohosh needs to have like supporting systems to it. So we have what we call a deputy or a minister. And this herb is helping that main herb by supporting and ministering to it where it maybe is lacking. So that's like kind of having a best friend that says, okay, you're really, really good at getting things done, but I'm really good at looking at the fine little details of things. So I'm going to make sure that you don't miss anything. And then you also have assistants that come along and help support. So it's very complex when you're creating that formula, and lots of things go into it. That's why it's really important for somebody, especially if you have a chronic disease. If you've got a cold or a flu, and taking herbs is wonderful for those conditions, and you don't have to worry as long as you're not taking something long term. But if you're going to take an herb long term, you need to think of it the same way that you would think of like a pharmaceutical drug. It's something that you would want to have monitored and checked by a professional to make sure that you weren't doing any damage to the body. One of the like biggest problems with herbal medicine is people assume because it's an herb that it's completely safe and they can't do any harm to themselves. But it couldn't be farther from the truth. And while herbs are much safer than a lot of pharmaceutical drugs, they also can come with negative side effects as well.
Thank you. Give us an example of how would you know that, let's say, the menopause has this hot and dry kind of energetics? And the reason I ask you this is, for example, like I've been having sore throat for the last 10 years and a cough as well. And how would you know there, for example, what's the energetics of that? How can you tell that?
Okay, so we'll go with the cough because this is a really nice and easy one that everybody can use at home to assess their cough. So with a cough, you either are going to have a very dry, kind of sharp, hoarse cough, or you can have a very moist cough where you're getting a lot of phlegm and fluid coming up, which is going to be kind of more like a pneumonia type cough. So that's the difference between the wet or the dry cough. And then to decide whether it's a hot or a cold, because you have to pull in the heat factor. So a hot type of cough is going to have very sticky, hard to expectorate mucus, and that mucus is going to be very kind of yellow colored. A cold cough is going to have a lot of fluids, but it's going to be very clear. And so the clear versus the yellow mucus are the two major distinctions when it's coming to phlegm that's being expectorated out of the body. So as herbalists, there's always a joke. We're always asking you about the fluids coming out of your body, your phlegm, and your poop, because those are important things to assess the heat, the temperature, and the dampness of the body out of what is coming out of your body. So for you, if you've had this long-term chronic cough, well, I'll give you my favorite herb. So I love, and this is one herb that can be used longer term by itself, and it's called Prince Sang. And it's wonderful for kind of long-term mild chest conditions because it is considered like the prince of lung herbs in traditional Chinese medicine. And it's a wonderful type of kind of adaptogen too that kind of helps to support the body. And for somebody who's had something like chronic, I might throw in some ginseng into that formula to just help support the body, to kind of improve its overall state. So there are some herbs that are good for just a long-term supportive by themselves, like Prince Sang. But if you've had this long-term chronic condition, as an herbalist, we assess like a cold in two different ways. We have to determine whether the cold is external or if it is moved internal to the body. So an external invasion with a cold is like that early onset of a cold when you have all of these acute symptoms, but they haven't driven deep inside of the body. And so this is when we really like to treat our colds. We really want to come at it with a lot of herbs that are going to keep those symptoms from getting deeper into the body. And then with a condition like you, where you've had that chest cold for a long time, which a lot of people are experiencing right now, that has internalized, meaning that whatever it is that has entered your body has found a safe haven somewhere in it. And this is usually somewhere where there's a lot of warmth and dampness, which is in the lungs. And when it comes to chronic lung conditions, people can often experience those kind of hot, dry coughs that don't really go away. And that's because you've got that heat. And I found a lot of herbs that are great for that, but one of the best things for expelling like a long-term virus is actually to go on a fast, and particularly to remove any sugar or carbs. If you don't want to go for an all-out fast, if you can remove all sugar and all carbohydrates from your diet for a couple of weeks, you essentially are starving out that bacteria or that virus. Because just like people who have cancer, those cancer cells need those carbohydrates, need those sugars for their survival. And they've essentially gone dysfunctional. So they're not acting in the same manner as our body's other cells. So our healthy cells in our bodies want fats, want lipids to help support them. When they become cancerous, they don't want the fat lipids anymore. They want the sugar and the carbs. So one of the most important things in a diet when you're experiencing disease or you're experiencing cancer is to get all of the carbs and all of the sugars out of your diet and go on a very, very strict diet, because that is going to help to kill off those cells. And then you make sure that you have healthy fats in your diet that are going to help to support the healthy cells.
Thank you. What about healing chronic sore throat?
So a chronic sore throat, so that's going to be the mucosal layer is under attack. So for somebody like you who's talking a lot to a lot of people and you're using your voice, one of my favorite herbal remedies is a plant called slippery elm. And it comes in a powder, and you essentially mix a little bit of the powder with a little bit of water and make a paste, and then eventually turn it into some tea and add it with lemon and honey. And the beautiful thing about the slippery elm is it causes the lemon and the honey to adhere to the throat. So for instance, if you were going to go onto a podcast or you were going to be doing an interview and talking a lot, I would have a cup of that slippery elm tea prior to going on to help to protect that mucosal layer. But then you have to think about, if you've had this chronically, same thing that I've said before is that something has found a place to kind of lodge in your throat, and it's damaging that mucosal layer. So you have to think about like working to heal that lining of the throat. So that's going to be doing lots of soothing things for the throat, like the lemon and the honey for it. But you can also do other things. Like I love to have clients when they're like facing an initial onset of a cold to gargle with some salt water and a single drop of iodine in that water. And what it's going to do is it's going to clear out all those little cracks and crevices of your tonsils and of your throat and help to heal that. And then of course, there's lots of herbs that I would give to my client that would be based upon their energetics to help to support their body's immune system.
Thank you. I'm addicted to coffee and I drink too much coffee. For those entrepreneurs or for those people that have chronic conditions due to addictions like mine to coffee, what would you advise them to do? Is there any herb that they can replace this with that would make it easy for them to like drink something else or to replace their bad addiction to something else?
Yeah, so when it comes to coffee, I actually do have a favorite because I once myself was a coffee addict and would wake up like a zombie, go to that kitchen, make a pot of coffee, and drink the entire pot of coffee every single morning. And so what I slowly tapered myself off of the coffee so that I didn't experience those caffeine migraines and have to kind of struggle through that is I used something called chicory root. Chicory is a medicinal herb with a lot of really wonderful supportive benefits to the body, especially the liver. And what they do is they roast the chicory root. And when it's made into a coffee, and I use a French press, it tastes exactly like coffee, but it doesn't have the caffeine and some of the negative side effects like depletion of the adrenal glands that coffee does. And so what I would slowly do, let's say that you're using the French press method like I was, and I would put 3 tablespoons of coffee in my French press originally. I would go down to 2.5 tablespoons of coffee and half a tablespoon of chicory, and then slowly increase the amount of chicory until I had reduced my coffee in my French press mixture down to the bare minimum. And what that helped to do was to slowly taper my body off of the caffeine. I still got my warm, dark beverage every single morning. So mentally, my brain is thinking that I'm receiving my coffee too, because part of addiction isn't just the physical effects of the addiction, it's also the action that the body's taking. So a lot of people who are trying to quit smoking, one of the hardest things is that action of actually breathing in deeply and exhaling. And then also getting that 5 minutes outside. So when it comes to things like quitting smoking, we have to replace some of those behaviors with something that's more beneficial. Now, when it comes to quitting smoking, one of the hardest things is that tobacco is a dopaminergic, which means it produces dopamine in the brain. And that is what the body becomes addicted to. And here's a little interesting tidbit. So tobacco is actually a medicinal herb that can be used, particularly with people with Parkinson's disease, because Parkinson's disease is a dopaminergic disease. The body has stopped producing dopamine. And so when somebody's going through a severe episode with the Parkinson's, we can actually put like a nicotine patch on them, because of course we don't recommend smoking because we don't want to damage the lungs. So they can wear a nicotine patch, and the slow infusion of the nicotine in the body will help to calm their Parkinson's episode. Now, of course, we have to be really careful as herbalists when recommending that to people, because you have to have a fine line between not getting your client addicted to the nicotine and still helping them to manage their dopamine. But there are other herbs that are dopaminergics, like lobelia. And so when somebody's quitting smoking, I'm going to give them several supportive herbs to help to support the dopamine production in their body, and then replacement behaviors. So maybe I give them some breathing exercises so they're still taking in those deep breaths. And then, their hands often need something to do, because you find that people that quit smoking have kind of an addiction to having something in their hands as well. And so back to the coffee too, is the point is that we have to allow the brain to have certain behaviors that it's become addicted to. So having that warm cup of brown coffee while reducing the body's physical chemical addiction to something. And so the best way to do that is tapering. And that's why I love the chicory root, because I could give you a cup of chicory root and you would think that it would taste pretty close to your cup of coffee. You might notice just a slight difference, but most people who've come to my house and drink my chicory root thought that I was serving them coffee.
Thank you. What about replacing, for example, coffee with lion's mane coffee, or this kind of like mushroom mixes? Is that a healthy?
So I've tried a couple of that, and the ones that I have had still had coffee inside of it mixed with the mushrooms. And so of course there's lots of benefits to the mushrooms, and we would have to get into the science of mycelium and the strain of mushrooms that they use, and whether they're using the whole mushroom or the mycelium to determine really whether or not you're getting benefits from the mushrooms. But there certainly are no negative known side effects to those mushroom blends. And so if somebody really likes the taste of that mushroom blend and it's helping to taper them off of their coffee use, like absolutely. With the coffee is we want to get you to the point where you don't need to have that coffee every day, and we can use it medicinally. So I occasionally will have a cup of coffee. If I have a really bad migraine, I will have a cup of coffee, because that cup of coffee is going to help with my migraine. And so there's somewhere where like us Americans are really used to taking medicinal plants on a daily basis, like tobacco and coffee. And if we can move ourselves towards seeing them as something sacred, especially with the tobacco, like the Native Americans did, a sacred substance that is used during ceremonies or at specific times when it's needed, then we can kind of bring back a wholeness. It's not to say that one should never have coffee, just one should use the coffee at an appropriate time.
Thank you. For those that, let's say, don't have the opportunity to meet you or to consult with a herbalist like you, are there any habits that entrepreneurs could implement so that they can start healing their chronic conditions with herbal medicine while waiting to consult with a specialist like you?
Yeah, absolutely. I think there are some really simple daily routines. So the first thing is if you are going to have coffee, don't have it be the first thing you drink in the morning. It's really damaging to the digestive system, the digestive layer. It can lead to chronic diseases like GERD and acid reflux and other issues because coffee is very acidic. My recommendation to everybody is to wake up first thing in the morning, warm a little bit of water and squeeze some fresh lemon juice into it and have a cup of warm lemon water every single morning. What this does is it activates the saliva production in the body. It activates the digestive juices. It helps to clean the mucosal layer of the throat and the stomach. So that's the other really wonderful benefit about the lemon juice is it's actually helping to purify that mucosal layer. And so what the fresh warm lemon water does is it moves through the body, stripping away that damaged mucosal layer and moving it out and helping to clean the bowels for the start of the day. And so I highly recommend just one simple thing. Of course, I have a list of, 5 or 6 different things that I do every single morning before I have my matcha latte because I, like everybody, want to have a warm drink in the morning. And so my addiction is matcha lattes. And then I make it home. But I make sure that I go through this whole process of my body, which includes brushing my teeth before I ingest anything to help to protect my teeth. I rinse my eyes with some cold water to kind of start the lubrication production of my eyes. I clean up my nose using like a traditional Ayurvedic oil for the nostrils, which helps to protect me when I'm out in the world from picking up germs and pathogens. And then I go through some breathing exercises and meditation. And after I've completed all of those things, then I allow myself to go on with some of my traditional American addictions, like my type of caffeine, which comes in my matcha latte. And so I really encourage everybody to start your morning routine, if you have to wake up 15 minutes earlier than you normally do, to have something that helps to center your body and focus you on your wellness before you jump right into checking your phone, reading your emails. And I'm an entrepreneur too. I have multiple businesses. I have 2 businesses and I'm a president and founder of a nonprofit. So it was a very hard thing to train myself to not wake up first thing in the morning and look at my phone and check all of my emails and messages that I had missed the night before. And so we have to focus on like ourselves and taking care of ourselves. And so implementing little routines are really important. And if you're going to pick just one of the ones that I mentioned, it's definitely the lemon water to help to purify the body system before we start giving it our toxins.
Thank you. Tell us where entrepreneurs can find you.
Yeah, so you can find everything that I'm working on at my website, bonniediarcangelo.com. And there you'll find my herbal products company where we make herbal products for chronic medical conditions such as neuropathy and arthritis and diabetic wounds. I have a real focus in my herbal products company. They're not like your run-of-the-mill things that you would find out there. They're really for people who are suffering from chronic pain because I have found that as an herbalist, it's really hard to get compliance out of my clients to take their supplements and their herbs if they're suffering in pain. So I worked really hard to develop these very specialized herbal topicals and protocols to help alleviate people's pain so that they can focus on their other wellness issues. So you can find all of my information on bonniediarcangelo.com.
Thank you. Follow me for more interviews with world's most innovative health changemakers to live your healthiest life ever.